And welcome back to Life Unrehearsed. My name is Matt Delvecchio, specializing in life transitions, downsizing in the senior living industry.
And I'm Corrie Sirota, clinical social worker and author of Someone Died, Now What? Matt, we're going to be talking with some speech language pathologists, and I understand, I think you mentioned it earlier, your daughter has had this service.
Yeah, it's certainly I'm very grateful for what I usually call speech therapists, but I guess speech language pathologists is what they're known as right now. And when my daughter, this is a long time ago, this is about 20 years ago, when my daughter was 2 or 3 years old, we clearly saw that she was delayed in her speech. You know, you compare it to your friends and other kids, and there was something So as it turned out, she was diagnosed with something called dyspraxia, which is it's a movement and coordination issue. Basically, you need to train your jaw and the tongue and the mouth. There's motor skills involved. If you think about, start singing the alphabet slowly, A, B, C, and think about pronouncing those words. You are using a lot of movement, back of the throat, front of the throat, and you don't realize it because that's what we're accustomed to. So boy, oh boy, we went for every week to 2 weeks for speech therapy for years, and I'm very, very grateful for what these wonderful speech language pathologists do, and so I'm very much looking forward to this next segment.
Yeah, well, it sounds like you become an expert when you have to become an expert, but the real experts are the people that we have on the line today. So we really did think it would be an interesting topic to hear from them. So on the line, we have Ishi Zachariah. She is a speech language pathologist who works at Summit School, the Center for Child Psychiatry, at the Jewish General Hospital and Elna Medical Clinic. And we also have Chelsea Osi. Chelsea is a very dynamic speech language pathologist. She also works at Summit School and is currently transitioning to work with McGill University and the McGill Fluency Center. So Ishi and Chelsea, welcome to Life Unrehearsed.
Hi.
Yeah, I was waiting for the in unison. Okay, you got that. We got, now that we have that over with. Okay, either one of you, I think we've established what's the role of a speech language pathologist.
I would love to tell you guys. Speech language pathologists have such variable roles. It's like when you're in grad school, it's really wild going there for 2 years and rushing madly to fit in all the training to assess and treat speech sound disorders, developmental comprehension and expression disorders, stuttering, swallowing, feeding, alternative communication. We use devices, signing, or even through a speaking valve through the trachea. And let's not forget social communication and voice disorders. There's a whole slew that we treat. Most speech language therapists specialize their work based on the age or medical diagnosis of the population. So, for example, a therapist working in a stroke rehab center likely doesn't also specialize in pediatric stuttering. So after school, we specialize. But when we're in school, by and large, we do a lot of things.
Yeah, you're just going on about it's amazing how many different issues there may be. It's real eye-opening. And what would you say are some of the more popular issues that you're seeing and that you're treating? Is it more for children? Do you also see adult? What are some of the popular ones?
So, Issy covered the umbrella of what we do really well. And then we get into the specifics where me and Issy, we both work in a more pediatric setting. So there we see a lot, and also our settings sort of specific and specialized in intellectual disability. So we see a lot of alternative and augmentative communication. We see a lot of comprehension and expressive difficulties in language. We see some speech sound disorders. And generally in the pediatric setting, you see a lot of that, like academics that are impacted by limited language skills, speech sound disorders or delays. And then once you get more into these specialized settings, that's where you really see what we call AAC. When I talk about alternative and augmentative communication, that's what I mean. So then you start using high-tech or low-tech, like devices to assist speaking or replace speaking altogether. But you can also work in adult settings, and I'm less familiar with this because I haven't done this since grad school, but there you really see the especially in medical settings, you see more swallowing issues, you see some voice disorders, and you can also see some difficulties with language, particularly after some sort of acquired injury. Let's say it's a stroke or a traumatic brain injury. So that's where you really see the differences.
So that is the voice of Ishi Zachariah and Chelsea Osi, who are both speech language pathologists. You know, I'm nervous now that I'm not speaking properly. I'm not going to lie. Anyways, here I am trying to enunciate every single syllable, whatever. But just saying, you are listening to Life Unrehearsed with Matt and Corrie, and we are talking to two very knowledgeable speech language pathologists. How would you know that a child would actually need these services? So let's start with the younger children. What would be the signs that would tell you maybe we should be bringing our child to see a speech language pathologist?
So parents are so often surrounded by growth charts and milestone markers, and like you were saying, the children are friends and family, so they can usually tell. Of course, there are pediatricians and educators who see lots of children, and they're also excellent guides for parents for when a child needs to seek help from a specialist. But I would say that the biggest marker would be when a child is clearly frustrated and is unable to communicate what they want. Whether it be searching for words, or they're stuttering, or they're saying words that they aren't understood, they need help. I say to parents that the best thing to do is to seek help sooner rather than later. Because if it turns out that your child doesn't need treatment, that you saw someone, then yay, all the better. And if they do, then they didn't lose time building up that anxiety of not being able to communicate. You know, once intervention has started or you've seen someone, it can only get better from there.
Yeah, I think you bring up such a good point, because a lot of time children, this is their lives, that's their normal, and all of a sudden they may realize, boy, I could be doing a heck of a lot better. And I saw that firsthand with my own daughter. And changing the tune a little bit towards adults now, do you see, what are some of the more challenging aspects to speech issues regarding adults? I would imagine, stuttering. Are there still stuttering in adults? And are there other issues concerning adults?
Yeah, so it definitely depends here. So there may be some persistent difficulties that were present at birth or in childhood, and that would really relate to, let's say, like language skills or speech sound disorders, like you mentioned, stuttering, and that could be impacting the ability to transition into work. So at that point, we'd be looking at a lot of functional skills. How do we best support this individual to enter the spaces of their daily life? And then there's also treating adults who have acquired some sort of communication or swallowing difficulty. So this would be, like I had mentioned, just strokes or TBI, and that would be more in like a medical setting, or doing some rehab at that point.
It's interesting to me, and I imagine that you see both psychological trauma as well as physical trauma that occurs, whether it be children or adults.
Most especially in stuttering, you see there are different triggers for stutters, and they can definitely be both. For stuttering, it's mostly psychological for a trigger, but with stuttering, you don't really know how it started. Is it physiological? We don't know. Is it genetic? Unsure.
Welcome back. You're listening to Life Unrehearsed. I'm Corrie Sirota, along with my co-host Matt Del Vecchio, and we're talking about expressing ourselves with speech language pathologists, Ishi Zachariah and Chelsea Osi. I really hope I'm pronouncing that correctly. I understand that, Ishi, you have a really good success story, probably of many, but one that comes to mind in terms of what work you did with a client. Can you share that?
I mean, we work with so many different kids at different times in our career, and there are some children and their stories that just stay with you, so I'd love to share. I had one such cutie who was a 3-year-old. who waddled into my clinic office holding onto both his mom's hand and his aunt's. We'll call him Jay for this story. So Jay sat most politely on my play carpet in my clinic. He was looking at my walls, looking at the door, looking at the floor, but he didn't acknowledge me. And he didn't have any words or any play or even answer to his name. And that really broke my heart. I went home that night and I researched and I called my other more experienced therapist friends, and I honestly wondered where I would even start with him. So eventually we started working on just looking at faces and teaching him how to imitate actions to then go on to communication, which was, a goal that we would get to at some point. And that mother's devotion to supporting her son's development is just my all-time favorite parent relationship in therapy, which you work a lot on. You work with parents and their kids. That mother rolled on the floor with him. She licked toys with him, really whatever was needed. And the day that Jay came running in when his name was called, after years of not answering to his name, I cried in my session.
Oh, that's beautiful.
Well, that is really what it's about, and good on you. You've changed the lives of a family, and I say family because I could relate. It's not just about the children. The parents are super stressed and they're worried about the children. Oh my goodness, and they're delayed and so on. So, so important. We'd like to address some of the latest therapies and methods that you're using. You talked about a good example there. So we're going to rattle off a few for you, starting, and we talked just before traffic about stuttering. What are some of the solutions you have for stuttering?
I guess I'll take that one on, as I treat a lot of stuttering. Stuttering carries the complexities of having a vague prognosis, the social consequences, the repercussions on mental health, and of course the actual difficulty of communicating. And in a good stuttering therapy program, all of these are worked out or should be worked out. The type of program that we would pick is really dependent on the age and the awareness of the stuttering of the individual. So I'll give you an example of one. Generally, for a younger child, we would wait 6 to 12 months after the onset of stuttering to treat it, because sometimes it grow out of it, unless it's really severe or it's impacting them really negatively. For a young child who isn't aware, I like to use a program called the Lidcombe program. It's from Australia. It's one of the most researched and with excellent efficacy, and it's largely based on positive reinforcement and modeling. So we set up the child to produce fluent speech for 10 minutes every day by reducing the environmental distractions, hiding emotions during the activity, lessening the speech demands we place on them, and then we reinforce the fluent speech that is happening. And this could be during a game, reading a book, some sort of structured activity. And then the next step would be to slip in a few corrections of stuttering. So every 10 praises gets only 2 corrections. And honestly, I wish we could all practice that model of intervention in life. It's wonderful. And then once the child is made aware of what we call smooth versus bumpy speech, we work on their attitudes towards stuttering, and we generalize those 10 fluent minutes into longer and longer periods.
So that sounds like I can understand why you feel so compelled to use this. Aside from the efficacy and the research, clearly it seems like a very gentle approach to a very real challenge for some. What about things like if they have some kind of motor skill issues? What would you be doing with them?
I could take this one. So if it's related to motor speech, coordinating movements that are required for speech, sometimes that will require targeting the speech itself. So you might create these drill-like practices around maybe, let's say, 5 functional targets or less, depending on the age of each child and how receptive they are to doing that type of drill practice. It's like if you're going to the gym, and you have to do 10 reps of this thing that you find really challenging, and then you see the progress over time. Your brain sort of memorizes the pathway that it takes to create this flow or this sequence of sound. So you train that, you drill your mind to perform that action for a really functional target. Let's say it's a family member's name, or the name of your teacher, or a name of a place you really like to go, so that it's really relevant to the child's or the client's needs, and it serves them in their daily life. So that could be like an approach for motor speech. But if you're dealing with perhaps a very severe motor speech disorder and you're looking more at augmentative communication approaches, then you might call on the support of a tablet, for example. And with the tablet, you don't just go like handing out iPads to any child you see too. You really have to look at their profile. Maybe that motor speech disorder is related to a more global motor impairment where they would have trouble finding buttons on a program, like a communication program. So they might have to use something that requires more like eye gaze or whatever it may be. But there's a whole range of supportive communication systems. Mm-hmm. And the tablet that I often use at Summit School it has a program on it where you're really practicing different categories. Maybe they're functional to your daily life, like the classroom or the home, and you can go in there and you have these folders for different things. So if you go in and you look at the folder for clothing, then you can practice labeling what you need every morning to explain to your mom, like, I want to wear the red shirt, not the blue shirt today, things like that. So that's really in a case where the motor speech impairment is so severe that there might be room to add supportive techniques to speech or to replace speech altogether.
Listening to Life Unrehearsed, Matt and Corrie here, and that's we're talking to speech language pathologists Ishi Zachariah and Chelsea Osei. We have to wrap it up soon, but first, one of the things that I learned going to speech therapy for my daughter and as a family, we're in this world now where we need immediate gratification. Things needs to get fixed. So my child has a speech issue, I need it fixed. And one of the first sessions that I had with our speech therapist was managing expectations. And, some speech therapy isn't happening overnight. It could take years and years. In the case of my daughter, it was a couple of years, 2 to 3 years. So can you just address that in terms of expectations of finding these solutions over time? What I thought was, okay, 3-4 sessions, we're good, but that's not the case in your world, is it?
Yeah. Maybe I can take this one, Ishi. So it's really like that, right? Like there are sometimes expectations that need to be addressed before you get into therapy at all, because yes, some people are expecting that it's going to be a quick fix, a Band-Aid fix, but oftentimes it's a lot of practice. And what a lot of SLPs have difficulty with is the idea that everything happens within the session, which is not true, right? Like you have to do a lot of work to make the client or the client's family understand that a lot of the work is actually done outside of the session as well. So it's the sharing of strategies, and it's really getting everybody on the same page. And that in itself is a big part of the work, actually. Yeah. So, sometimes you're spending a block of therapy, let's say like 3 or even up to 10 weeks, just building a relationship with the family and understanding what their priorities are and what their vision is for whoever the individual receiving services. Right. So a lot of the time, you really have to, a big practice is the counseling aspect and understanding what their expectations are and either trying to align them with the plan or trying to modify them so that you can make their expectations more realistic. Because it's not always going to be the case that you have a good idea of what the short-term goals should be. And that's really the SLP's job, to get you sort of more well-aligned with what's possible in a given time frame.
And understanding that time frame. And as I've learned, patience is a virtue. All right. Well, thank you, Ishi and Chelsea. Thank you for sharing some really informative information.
Thank you for having us.
Thank you. It's Ishi Zachariah and Chelsea Osei, 2 impressive speech language pathologists doing some wonderful work. Corrie, all right, what do we have coming up next week?
Next week, it's Breast Cancer Awareness Month. So we have Karen Malkin-Lazarevich, who's going to tell us how tattoos can be a tool in helping women recover from mastectomy trauma. And we're going to hear a heartwarming story about a social work student that spearheaded a program to donate sneakers to an entire high school as a way of giving back.
Yeah, looking forward to that. And especially Karen, it is Breast Cancer Awareness Month, so we're going to dedicate some time for a wonderful lady. All right, thanks for tuning in to Life Unrehearsed. And as a reminder, for all your inquiries or assistance with retirement homes, seniors residences, or downsizing, it'd be my pleasure to help. Our services are completely free. Call me at Lianas Senior Transition Support, 514-622-8074.